Assalamualaikum warahmatullahi taala wabarakatuh. My name is Fidaus bin Abdurrahman, and following me there is other two group member, which is Afiq Shauki bin Abdul Qadir and Nur Huda binti Anwar. Our group will be presenting to you a topic about good health and well-being. Okay, for the good health and well-being, the good health is a state of complete physical, mental, social well-being and the absence of disease or infirmity, while the definition of well-being is the state of being comfortable, healthy, or happy. So we need to understand the health risks. A health risk is the probability that something will harm or affect your health. The risk does not mean that something bad will definitely happen. It is just a possibility. Several characteristics called risk factor affect whether your health risk is high or low. So how can lifestyle affect health? Okay, millions of people lead unhealthy lifestyle. This led to illness, disability, and even death. Problems like metabolic disease, joint and skeletal problem, cardiovascular disease, high blood pressure, obesity, violence, and so on can be caused by an unhealthy lifestyle. Cause of health problem can be as simple as a person's genetic makeup. Okay, the lifestyle habit also can be the cause of health problem, such as smoking. Okay, the other cause is like exposure to toxic substances such as asbestos and other few reasons. Okay, the top most common health issue is physical activity and diet, overweight and obesity, smoking, substance abuse, HIV or AIDS, mental health, injuries and violence, quality of the environment, immunization, access to healthcare.
Thank you, Firdaus, for explaining what actually means by good health and well-being and how it could affect us. Now I'm going to explain the example of health problem you're going to get if you didn't take care of your good health and well-being. Firstly, not getting enough physical activity and nutrition can lead to heart disease. This is because even for some people who doesn't even have any health issues, it could increase the likelihood of developing any other risk factor including obesity, high blood pressure, high blood cholesterol, and diabetes. Next is overweight or obesity is a serious matter because it's associated with the poorer mental health outcomes and reduce the quality of life. Obesity is also associated with leading causes of death in the United States and worldwide, including diabetes, heart disease, stroke, and any other cancer type. Next is tobacco. Even if you're a smoker, you could feel sometimes it is hard to breathe. Why? This because smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. Smoking also increases the risk of tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. Next is mental health or mental disorder, which includes depression, bipolar disorder, schizophrenia, and etc. There are effective strategies for preventing mental disorders such as depression. You can seek help. Next is injuries and violence. Injuries such as falls, motor vehicle crash, intimate partner violence, and child maltreatment are the major public health issues. Unintentional and violence related injuries cause nearly 200,000 deaths each year and are the leading cause of death of people aged 1 to 44. Last but not least, substance abuse is a medical condition problem that interferes with a person's relationship with their friends and family. It interferes with person's ability of work, school, or family obligation. It also results of legal problems and dangerous behavior with others around them too. So that's all from me. I'm gonna pass it out to Afiq Shauki now. He's gonna continue on how to keep a good health and well-being.
Okay, thank you for Fidaus and Huda for the explanation so far. And now I will explain to you about how to keep a good health. Okay, first, eat a healthy diet. Healthy eating means eating a variety of foods that give you the nutrients that you need to maintain your health, feel good, and have energy. These nutrients include protein, carbohydrate, fat, water, vitamins, and minerals. Nutrition is important for everyone. Second, be active. Physical activity is defined as any bodily movement produced by skeletal muscles that requires energy expenditure. This includes exercise and activities undertaken while working, playing, carrying out household chores, traveling, and engaging in recreational pursuits. The amount of physical activity you need depends on your age group, but adults aged 18 to 64 years should do at least 150 minutes of moderate intensity physical activity throughout the week. Increase moderate intensity physical activity to 300 minutes per week for additional health benefits. Third, don't smoke. Smoking tobacco causes NCDs such as lung diseases, heart disease, and stroke. Tobacco kills not only the direct smokers but even non-smokers through second-hand exposure. If you are currently a smoker, it is not too late for you to quit. Once you do, you will experience immediate and long-term health benefits. If you are not a smoker, that's great. Do not start smoking and fight for your right to breathe tobacco smoke-free air. Number 4. Talk to someone you trust if you're feeling down. Depression is a common illness worldwide with over 260 million people affected. Depression can manifest in different ways, but it might make you feel hopeless or worthless, or you might think about negative and disturbing thoughts a lot or have an overwhelming sense of pain. If you're going through this, remember that you are not alone. Talk to someone you trust, such as a family member, friend, colleague, or mental health professional about how you feel. Follow traffic laws. Road crashes claim over 1 million lives around the world and million more are injured. Road traffic injuries are preventable through a variety of measures implemented by the government, such as strong legalization and enforcement, safer infrastructure and vehicle standards, and improved post-crash care. You yourself can also prevent road crashes by ensuring that you follow traffic laws such as using the seat belt for adults and child restraint for your kids, wearing a helmet when riding a motorcycle or bicycle, not drinking and driving, and not using your mobile phone while driving. And number 6, have a regular checkup. Regular checkups can help find health problems before they start. Health professionals can help find and diagnose health issues early. When your chance for treatment and cure are better, go to your nearest health facility to change out the health services, screenings, and treatment that are accessible to you. So, that's all, and thank you for watching.